Hi, this is Peggy O'Connor, and this is part 3 of the 6-part pre-class assignment, and it's on tonsillitis. Tonsillitis can be caused by a virus or a bacteria. The tonsils become inflamed as a result of this infection, and it's known as hypertrophy of the palatine tonsils. The diagnostic procedures are visualization of the palatine tonsils, a throat culture, and when you see the palatine tonsils, they appear large and inflamed. In order to visualize the adenoids, they need radiologic studies because they sit on top of the palatine tonsils. Signs and symptoms of tonsillitis: the child will have frequent throat infections, breathing and swallowing difficulties, enlarged cervical lymph nodes. They're mouth breathers. They have dry, irritated mucous membranes. For adenoiditis, they will suffer from nasal stuffiness, nasal discharge, postnasal drip, coughing, and excessive throat clearing. This is a photograph of the tonsils that are swollen, and they have a purulent exudate. They also have that purulent exudate on the tongue. And there is a YouTube link that I'm going to insert as a hyperlink into the assignment so that you should view this little short video clip from YouTube on tonsillitis. Medical treatment for tonsillitis is only when they're symptomatic. Child would receive acetaminophen for pain and fever. If it's bacterial, they will receive antibiotics to treat that bacterial infection. They should be offered cool, non-acid foods, ice chips, and frozen juice pops. Surgical treatment, called a tonsillectomy, it now occurs when there are frequent recurrent infections, generally 3 per year for 3 successive years. When a child has chronic tonsillitis, obstructive sleep apnea, or there are malformations that in their tonsils that cause sleep disorders, if there's a facial growth abnormality, and if the child is under 3 years of age, the surgery should be postponed as long as possible because the tonsils can grow back afterwards. So nursing assessment, you want to assess for fever currently or by history, whether there's a history of pharyngitis, which is sore throats, or tonsillitis, whether there's hoarseness or a muffled voice. You want to inspect the pharynx for redness or enlargement of tonsils and assess for difficulty of breathing or swallowing. Look at the tonsils, and if they're so swollen that they touch at the midline, those are known as kissing tonsils. The airway may become obstructed, and inflamed adenoids can cause obstructed posterior nares. They present as mouth breathers or snore, and you can palpate the cervical nodes for tenderness and enlargement. You would want to do a rapid strep test or a culture for looking for positive strep group A. So for nursing management and interventions, preoperatively, we want to ensure that the child is not going to be at risk for infection, and so by doing that, we are going to make sure that there are no signs and symptoms of tonsillitis, and we want to make sure that they are not at risk for postoperative bleeding, so we want to make sure that the clotting studies are normal, so their PT, PTT, and platelets should all be normal. Postoperatively, one of our goals is to promote airway clearance, so we want to make sure that the child is fully awake and in the side-lying or prone position to facilitate drainage safely. Once they're awake, we want them to sit up or elevate the head of the bed. We want to suction them only if absolutely necessary, and dried blood might be on the teeth, nares, and in the emesis, and so we might want to inform the parents of that so that they will not be nervous. So in order to maintain fluid volume, we want to encourage fluid intake, offer cool or cold clear fluids, no milk products until 48 hours after surgery because the milk will cause them to clear their throats, and that can cause bleeding to reoccur. We don't want to offer citrus, brown, or red fluids. Citrus fluids can actually cause irritation and cause the scabs to come off early. Brown or red fluids should be avoided because if the child vomits, the parents might not be able to recognize the difference between the color of the fluid and actual dried blood or fresh blood. You want to calculate what the 24-hour fluid volume is for this child, and they need to drink between 1/3 and 1/2 of their daily fluid requirement before discharge. The goal is to monitor for postoperative bleeding. Hemorrhage can occur immediately post-op and up to 10 days after surgery. You want to inspect the throat for bleeding by visualization. Mucus-tinged blood can be expected. Fresh blood in secretions indicates bleeding. Continuous swallowing or frequent clearing of the throat can indicate bleeding, and other signs of bleeding could be tachycardia, pallor, restlessness, or emesis of bright red blood. And if the child should hemorrhage while they're in the hospital, the physician needs to be notified immediately, because the child will go back in immediately for surgery. If the child is at home, then the parent needs to take the child to the nearest emergency room for immediate treatment. The next nursing measure is relieving pain or maintaining comfort. Acetaminophen or Tylenol at a dosage schedule of 10 to 15 milligrams per kilogram per dose every 6 hours should be administered around the clock. Tylenol with codeine is no longer recommended, and that is because the codeine can have a delayed absorption, and then when it is absorbed, it's absorbed all at once, and then the child can have respiratory compromise as a result of having too high of a dose of codeine in the bloodstream. You can use an ice collar for comfort. To prevent trauma to the surgical site, discourage the child from coughing, clearing their throat, blowing their nose, or using straws, and no straws. For home care, we want to make sure that we teach the parents to report any sign of bleeding to the physician or nurse practitioner, to drink plenty of cool fluids, no milk products until 48 hours post-op, acetaminophen or Tylenol every 6 hours around the clock. They could use an ice collar, and no suctioning the back of the throat. This is the end of this section, so now you can move on to the fourth section.